Hi, my name is Tesfa Alexander. I am the Deputy Director for the Lerner Center for Public Health Advocacy.
So what drew you to studying communications for your bachelor's and master's degree?
Oh, that's a great question. I've always had an appreciation for the arts, as well as the sciences. In undergraduate school, I first was an engineering major and minored in communication. And during my time in undergraduate school, I realized that my passion really wasn't communication, but also recognizing the value of the sciences. And throughout my career, I've had unique experiences to marry the two, seeing how data, information can inform programs and inform health policies, but recognizing the value of using communication to transform, transcribe, and translate the importance of those programs and the policies that help support our communities. And so I, throughout my career, have been in this intersection of science and communication and have seen a lot of value and the power it can have to move people to change.
You got your PhD in health communication, and I was wondering what you think the biggest challenge for health communication is right now.
Yeah, I think the biggest challenge for health communication is the biggest challenge that we face for the field of public health. Our understanding as a nation and as the world, what public health does is framed within the COVID-19 pandemic, and that wasn't our best moment as a field. And so the biggest challenge for us is overcoming those perceptions of what public health is and what we do, and those misperceptions of what we do that's been shaped by the pandemic, and moving forward and bringing light to all the great work that we've done historically over the past 50 years, over the past 100 years, and what we will do moving forward for the next 50, 100 years. So I'm looking forward to us really sharing what we do in the field of public health and expanding the worldview and perspective of the great work that we have done and will do in the future.
What is your approach to navigating the challenges of health communication?
Yeah, my approach to navigating the challenges we face right now as a field of public health is to make sure we first seek to understand before we then seek to be understood. And that starts with empathetic listening. As we all know, public health is interwoven in everything that we do, from the economy to national security, to obviously directly the health and maintaining the health of the communities that we are a part of and that we serve. And it starts with us first understanding what are people's concerns, what is that they value, what are they interested in, and what are their goals, and understand how does public health fit into that story rather than forcing them to fit into our story as a field of public health.
Very nice approach.
Can you give an overview of what your career has looked like thus far?
I've had a really windy, intentional career. I describe my career as not being a straight line, but a windy road that's led me to right where I am right now, is where I've always wanted to be, and I'm so grateful for it. I've had opportunities to work in the federal space. I used to be the division director for health communication research and marketing at the FDA Center for Tobacco Products, where we led large-scale national tobacco education campaigns. And in that work, I was fortunate to lead and work with tremendous leaders, tremendous and passionate scientists, marketing professionals, to avert thousands, hundreds of thousands of youth from using tobacco and vaping products, and also save our country $53 billion in healthcare savings.
Wow, all from, I guess, prevention?
Exactly, directly from prevention marketing.
It seems like one of the challenges public health professionals face is showing people what has been prevented through their work. It's easy to see what's going wrong, but it's not as easy to see what's going right. So how do you go about marketing prevention?
Yeah, for sure. That's a great question. Prevention is hard to measure, as you point out, but it can be done. It can be done by working with a team of scientists, economists, as well as others. And to answer your question directly, in terms of measuring prevention, what you do is model out what could happen and what you expect to happen, looking back at data in comparison to what has happened. And having attribution is key. So with the work that we did at the Food and Drug Administration with our public education campaigns, we were able to measure awareness of our campaign, direct changes due to exposure to our campaign in knowledge, attitudes, and beliefs about tobacco products, and then ultimately those behaviors, and modeling that out and looking at trends as well as epidemiological data around tobacco use and what they were following a few years after that campaign in comparison to the trajectory that it was on, and controlling for other factors, external factors that we know helped also to reduce tobacco use.
What kind of impact do you hope to have, either at the Bloomberg School or just in general with your field?
The impact that I hope to have is the impact I hope we all have. It's not just about me, but it's about us as a field, it's about us as a school, it's about us as a department. And the impact I hope we have is that we rebuild the field of public health from where we are now, and as I mentioned before, look back 2, 3, 4, 5 years from now and recognize that from all the challenges that we've gone through, we've built back better and more successfully.
What courses are you looking forward to teaching here at the Bloomberg School?
As a new faculty member, I'm looking forward to teaching 2 courses. One, a non-matriculated course on creating stories for social and policy change, where we know that stories have a tremendous amount of power for moving people to change and moving people to action. And then also teaching marketing in and for public health in 3rd term, which will be for our master's and DRPH students.
Speaking of stories, are there any books or movies, any form of media that is one of your favorites, or anything you've listened to or read recently that you've really enjoyed?
Yeah, I highly recommend The Science of Stories by William Storr. Highly recommend this book for anyone who's interested in how our minds work. I think it'll be an eye-opening experience for you to understand the power of stories. And the second one is Resonate by Nancy Duarte. This is a great marketing book that anyone can use in terms of the insights that they provide on how to be an effective orator, an effective writer, and just an effective presenter. 2 books that I highly recommend.
As a marketing specialist, I'll have to write this down.
Yeah.
What do you like to do to decompress?
I love to eat, first of all. That's what I love to do to decompress. And on the flip side of it, for all that eating that I do, I love to be active. I love to play basketball. I love to run. I love to kayak with my kids, ski with my kids. If you give me the opportunity to just move, I'm all for it.
Yeah, based on the plants behind you, it seems like you've got somewhat of a green thumb.
For now.
We'll see how long it lasts.
Exactly. Come back a month from now. We'll see if they're green. It's a green or a brown thumb.
Do you have any advice for your younger self, or anything you'd want to tell your younger self?
Yeah. It's a great question. Advice for my younger self. Advice for my younger self would be to, no matter what phase of life you're in, no matter what position you're in, stay true to yourself.
What do your parents think of your career path so far?
My mom is so proud of me, and I'm also so proud of her because she's done so much to support me throughout my life to get me to where I am now. And where I am now is not the final destination. There's so much more to go. And my mom, as a nurse, is especially proud that I'm here at the school to partner with others, not just within the School of Public Health, but also in the School of Nursing, the School of Medicine. And she couldn't be more proud of where I am, and I couldn't be more grateful of her and the support that she's provided me.